So now still on health and the burden of childhood cancers remains a remains a global health concern as the cases continue to soar. Now experts say half of these global cases could occur in Africa by 2050, whereas up to 70% of cancer cases in children are curable. Children in sub-Saharan sub-Saharan region continue to bear the brunt of the disease. Preventable deaths and treatment failure are just but among challenges that bedevil cancer care among this demographic. And as the world observes a childhood cancer awareness this month, our health and science reporter Gloria Milimo explores how the shortage of pediatric cancer specialists in Sub-Africa is impacting cancer care.
Rukia Ali has always looked forward to the day she will carry her baby through the gates of Kenyatta National Hospital to the waiting arms of the outside world. For close to 2 years, this place has been home to her and her baby, who was diagnosed with leukemia, a blood cancer, at the age of 6 months. Life for her and her baby has been a constant reminder of the distress the disease can cause a family. But today, that long and dark chapter of their lives is coming to an end. Just like many parents, before getting the diagnosis that left her with a range of strong emotions, her baby had been undergoing treatment for other diseases.
Ninampeleka hospitali mingi ambayo siwezi sema ni hii na hii, lakini sana sana alikuwa anatibiwa pneumonia, mara naambiwa pneumonia, mara naambiwa homa tu, kila saa nikienda nikirudi, lakini kenye ilizidi sana ilikuwa ni kukohoa.
Despite the countless medications, his situation did not improve. He was seemingly trapped in a maze that most patients find themselves in when health practitioners fail to nail a diagnosis. The situation could be even more dire, considering that half of all global childhood cancers could occur in Africa by 2050, according to a report published in the Lancet Oncology. The burden of childhood cancers in the continent is worrying. Health experts say children are dying needlessly, as survival rates remains 2 out of 10 compared to 8 out of 10 in countries such as the United States of America. So what could be fueling these avoidable deaths? Experts say failure to diagnose these children is attributed to a shortage of pediatric cancer specialists, not only in the country, but sub-Saharan Africa as a whole. The report, published in the Lancet Oncology, further showed that children in most countries in the region are being treated by healthcare workers with no special training in cancer care. Dr. Sarah Muma, a pediatric hemato-oncologist at the Kenyatta National Hospital, explains this shortage.
The number is quite low compared to what we need, but that has only increased in the past maybe 4 or so years. But in the past there were very few. So at the moment there are about 12 pediatric hemato-oncologists.
This shortage, as seen in these low and middle income countries, lead to delayed diagnosis, avoidable deaths from childhood cancers, abandonment of treatment, and use of herbal medicines and alternative treatment that more often than not hampers the outcome of cancer treatment.
Some of these children, if there's no suspicion for malignancy, then they get on being treated for other illnesses. Usually a lot of infectious disease, so maybe tuberculosis, maybe recurrent pneumonias.
Currently, only 4 countries in sub-Saharan Africa provide specialized training in childhood cancer care. These include Tanzania, Uganda, Ghana, and South Africa.
The challenge we face is the initial investigations to make a diagnosis. There are certain investigations that may not be fully catered for, and that can pose a delay for us. The other thing, of course, is in the training, capacity building.
The report calls for immediate effort to improve childhood cancer outcomes in Africa, and that political prioritization of pediatric cancer treatment by governments and health systems will go a long way in tackling this health challenge.
For most families, by the time we are getting to the end of treatment, their resources are completely depleted. And these are the areas in which it would be wonderful for us as a nation to prioritize this treatment. We have also put in proposals and we are lobbying for free therapy for children, especially under 5 years. We believe that they're not in a position to do any fundraising or get things for themselves.
The World Health Organization estimates that globally about 400,000 children are diagnosed with childhood cancers annually. In 2020, about 2,300 children under 14 years were diagnosed with the disease in Kenya. This number, as explained by Dr. Muma, is often on the rise.
At any one time, we have about 100 children within the unit undergoing treatment. Also, during our clinic, when we run our clinic once a week, we have every Monday, we see also about 50 children in the clinic. So new cases and those continuing treatments. As well, I would put our estimate number of new children that we see every week making a diagnosis, maybe 3 to 5 children who are within the hospital for whom we make a new diagnosis.
The most common types of childhood cancers include leukemia, solid tumors like neuroblastoma, Wilms tumors of the kidney, and brain cancers. Research and training is a critical facet in improving childhood cancer outcomes in Africa to equip the country's healthcare professionals with knowledge to help in diagnosis and general management of these cancers among children.
We have the Kenya Society of Hemato-Oncologists, where the adults and pediatric hemato-oncologists in this country, we come together, we meet annually, we also have various meetings throughout the year. And a lot of lobbying is happening through this to explain the challenges faced in terms of treatments, access to treatment, making this early diagnosis, and then we present these forward through the to the Ministry of Health and work with them to develop plans that can support the children.
And in a bid to curtail flight of talents and improve retention rates among this critical cadre of healthcare professionals, experts call for their better remuneration and welfare. Gloria Milimu, KTN News.
And that story by my colleague Gloria Milimu when it comes to cancer in children brings us to the end of tonight's bulletin. Zachary Gitau has been a sign language interpreter. My name is Brenda Zederadido. To the men and the women behind the scene who've made this bulletin a success, asante sana, including you, our viewers. Thank you for watching. Enjoy the rest of your viewing, including your weekend. God bless.